everybody. Melissa Brannon with Startup Prize, and we are back for another Founder Spotlight. And today I have with me Kunal Shah. Hey, Kunal, what's going on?
Hey Melissa, I'm doing well. How are you? Of
I'm doing great. Thank you so much for making the time to join us. I'm wondering if
course.
you want to start out, tell us a little bit about yourself and a little bit about ClaraSim.
Yeah, absolutely. So I'm a biomedical engineer turned entrepreneur. I kind of followed this path because I realized that a lot of the things that I had been able to work on as an engineer, they taught me a lot of things and they're really interesting to me for a finite period of time. But I kept getting bored in every role I was in. And
Yeah.
so I was like, I need something that, makes even less sense.
Mm-hmm.
And I wanted a chance to try and use all those different skills and things like that that I'd acquired towards one end goal. And so that's why I decided to start trying to take medical technologies to market and commercializing. And what I'm working on right now to that end is called ClaraSim. Basically, our philosophy is that medical imaging, the way it's currently presented to practitioners, people like surgeons and dentists and other interventional physicians, isn't giving them the information that represents what they're actually experiencing in a procedure, right? If you look at medical imaging, it's presented in two dimensions at a time. You're looking at a slice of the patient's anatomy that captures a moment in time. But surgery, dental procedures, interventional procedures, they don't happen in two dimensions at a particular moment in time. The anatomy is three dimensional. It's changing every second that you do something to it. Um, and it's not just about what you can see, like on a scan, but these practitioners are also gaining insights from what they feel, what they hear, this full multisensory experience. And
Mm-hmm.
so there's this pretty big discrepancy between what um, imaging is telling the practitioner and what the practitioner actually needs to know to provide the best care to the patient. And so that's what we're trying to bridge. We're trying to bridge that gap, and we're trying to make it. We're basically trying to create a system in which practitioners can um, interact with imaging in a useful way. The way we've done that is by building a virtual simulator that's patient specific. And so we can actually take the patient's pre-op scans, feed it into our system, and then the practitioner can look at a fully virtual model, but it's rendered in 3D, no glasses, no VR, nothing. So it looks like there's a floating um, piece
Real.
of the patient's anatomy in front of their eyes.
Uh-huh.
Um, and then they can actually use like a haptic feedback tool
Mm-hmm.
to interact with the model and do a full dry run of the procedure. The model's updating in real time, the way the patient's anatomy would. They're feeling haptic feedback and they're feeling that the textures of bone, patient specific, density specific, the way they would in a real procedure.
Mm-hmm.
And they can actually see what steps they need to take to be able to do that and then share that plan with the rest of the care team without a problem. So that's kind of
So
what
do
we're doing.
you see this as kind of like using for training, or is this more like maybe those more complicated procedures where you want to kind of
Yeah.
put a test run or
Yeah, I mean, I think it's a little bit of both. I think the focus is really the pre-op planning for complex cases.
hmm
I think that's where a significant amount of the value lies because our model is patient specific. And, if someone's going to perform the same surgery on you, Melissa, or me, but our anatomies are going to be
Sure.
different, our ears are going to be different, our sinus is going to be different, teeth are different, right? Um, and because of that, any complications that might arise in my procedure might be different than ones that might arise in yours. And hopefully this would allow all of that to kind of be out on the table instead of having to hope that that information comes across in imaging, which sometimes it does and sometimes it doesn't.
Yeah. Well, what's interesting, is what I love about talking with you is, you originally came to Startup Prize with a completely different concept,
Hmm.
right? You came to us
Yeah,
with Rithio Medical, I
yeah.
believe when you were you still at Rice at the time, maybe, or
I had just finished at Rice, so I had just spun out the tech from my master's work.
wow. So what made you come back? I mean, like obviously Rithia Medical is maybe you're no longer working on that.
Yeah.
But like what caused you to come back? Like why Why come back? What drew you
Well,
back?
I think one of, and not just startup price specific, but one of the things that I have found to really enjoy about this process of trying to bring medical technologies to life is that there are a lot of different facets to consider, and a lot of times in really surprising ways, different hurdles that you might think of as independent actually can work together and try to solve each other. And then there are other times where it's exactly the opposite, where the problems compound and
Right.
there's a much bigger issue to solve, right? Um, but just navigating the puzzle of how do I manage not just some innovative technology, but how do I make sure that it's safe and reliable enough for
Hmm.
healthcare, like a standard consumer technology. If it works 99% of the time, it's fantastic. Medical technology, if it works 99% of the time, that's horrific and should never be used. So how do I manage that with trying to do something innovative that no one's ever done before and have it work with um, the workflow of how medical practitioners operate or how patients operate and what they'd like to do. Um, and then also have it work with the economics of how these different medical institutions operate and make sure that this is something that's sustainable and can grow for a long time. And then also make sure that it's equitable and it's helping, the entire patient population that it's designed to help and not, based on biased information one way or the other. Um, and then also understanding how can I market this effectively? How can I raise money? How can I be a business person and a salesperson on top of being an engineer and trying to be a medical device innovator, right? And so all these things compound, and sometimes as a founder, it's hard to keep it all straight. Um, I really liked, when I came in with Rivio, obviously in the early stage, we're always figuring this stuff out. I'm figuring this out in real time. For years to come, even as we continue to grow, I will still be figuring all this stuff out. Um, and I found it very useful to be able to talk this over with a different group of people that I don't normally interact with. Because there have been people that have trained me, people that have mentored me, people I look up to, and by and large, I follow the same philosophy that I gather from those people. But there are plenty of other qualified people in the world, a large group of whom come to Startup Prize and are involved there. And I found it very useful to run my ideas, my assumptions, and my hypotheses by a group of people who had never seen it before. And
Hmm.
it gets very different in a short pitch setting where you have 3 minutes and you kind of just like hit the highlights and there's a structure you follow and um, it's a bit more storytelling, but with the expanded process where I can actually sit down and talk about the business and not just walk through a pitch deck. I found it really useful to challenge the assumptions I had, um, help navigate some of the interconnectedness that I talked about earlier,
Hmm.
and I wanted to do that again as I set out with ClaraSim and was in again I applied when I was in the very early stages, just a few months
Hmm.
in, um, and I was like, these are all the things I need to figure out. These are my current assumptions for each one.
Hmm.
Let's see if someone can help me prove, disprove, or call into question um, any of these assumptions, and that's what I wanted.
I love that. So
Yeah.
since last year with ClaraSim, kind of tell us since competing, I mean, I know y'all have just made some big strides lately. Like tell us kind of
Yeah.
what's kind of what are those like next milestones and maybe kind of like what are those what are those milestones you've recently hit? And then what are those next milestones on the horizon that we can help you with?
Absolutely. So, for I started working on this in December of 2023. So we're a little over a year in. Um, and this started as an ENT surgery product. So we were looking at ways to help ENT surgeons, like otologists, neurotologists, sinus surgeons, better rehearse their patients' procedures.
Mhm.
Um, and what we built seems to be drawing a lot of interest. We picked up a pilot at Houston Methodist Hospital, where we're working on setting up another pilot at Columbia University in New York City, um, and we're seeing so much interest from surgeons.
Mhm.
Um, the issue is as we walked through, like, hey, we started talking to the surgeons that loved it and said, hey, what is this going to take um, to be adopted? Like, let's say you love this, you try it
Right.
out for a year. If we get to a point, I want to make sure that I'm not holding you back. Whenever you're ready to move forward, you move
Mhm.
forward. So we started talking through all those, and to no one's surprise, there are 12 to 18 to 24-month timelines for getting anything adopted widespread in a hospital. Um, we're up for that fight, and we want to go there. But in the meantime, I was looking at other areas we can solve because I don't want to sit on my thumbs and wait for the research to come in um, on how the ENT product is doing.
Mhm.
And I was going to this conference. It was just after I was really sick that week. We had just set up the pilot at Houston Methodist, like the day before. It was also just after my wedding. I was exhausted. It was it was not a good day, and I was invited
Mhm.
to come to the um, the Consumer Electronics Show in Las Vegas this week. And so I was like, I don't know, surgeons aren't there. It's not really my crowd. I don't know what we're gonna do.
Mhm.
Um, but this group was like, hey, we have a big booth. You could be a featured presenter. You know, come by and try it out. So I was like, okay, fine. I booked a last minute Frontier flight to Las Vegas. Um, you know, showed up there, set it up, suffered through whatever illness I had that knocked me out, and got through the days. And on the last day, it was like, okay, I don't know if this is worth it. I didn't really like meet anyone. The last morning, I came across. I was like, we're getting ready to pack up for
I
my
know.
flight
Always
back.
like that.
Always lesson. I met a a dental distributor, a very prominent dental distributor, like one of the top handful
Mhm.
in the country. And they saw it and they were like, dude, have you thought about dental use cases for this? Um, I mentioned I had thought of it. I was like, that's going to be in the roadmap. We'll get
Mhm.
to it later. Um, and they were like, no, like I think this can solve some problems right now.
Mhm.
Um, I was like, okay, so tell me more. So the rest of the day we were talking, the next 2 weeks, I was like constantly on the phone with these guys.
Uh-huh.
And we realized how big of a problem there is um, with dental implants. Like
Mhm.
dental implants right now, um, there are so many practitioners that have the opportunity to serve patients and perform dental implants for them, um, but they can't because the imaging that they're getting, going back to our original thesis, is not giving them the information they need to safely perform the procedure. And so for the good of the patient, they have to refer them out to someone that takes more time, it's more expensive, it's another office visit that they have to take time out for.
Right.
It's another physician that they have to get comfortable with.
Mhm.
But that's the only option for a lot of these practitioners. And so we realized that there is an opportunity for us to use our technology to break down the um, the one barrier between opening up a lot of dentists, giving them the opportunity to perform dental implants. And so I was like, okay, what is this going to work? From that conversation, when I was, basically throwing up at CES,
Mhm.
um, within a month, we built a dental MVP, presented at a dental lab technician meeting in Chicago,
Mhm.
um, met the chief clinical officer of two of the biggest DSOs, dental service organizations in the
Wow.
country. We started working with someone that owns a line of dental clinics that they have the same thesis as us. They
Mhm.
want to allow general dentists to basically elevate and do these high complexity, high revenue procedures. And he's basically creating super GPs. And so this aligned, we met them, we're starting to work with them.
Mhm.
And we're seeing a ton of significant traction, especially on the dental side. And we're hoping that that comes in and we can really serve this use case really well.
Mhm.
And you know, one of the amazing things is while this is going on, we're still able to collect the research data that we need on the ENT surgery side. And
Mm-hmm.
even though, the structure of an academic surgical center moves a lot more slowly, and a
Right.
dental clinic can move a lot faster. But just because we're able to get this traction on the dental side doesn't mean that anything's really slowing down on the surgical side, which is super, super exciting for us. And so we're kind of building that out, and I'm realizing that with these conversations we're having, these DSOs, the dental practice operators, the dentists themselves, um, they're asking for a lot of things that can make this really useful and level this up for them.
Mm-hmm.
And my, ragtag team of um, ClaraSim engineers and folks that are committing nights and weekends to this out of passion for the work. Um, they deserve more, and as a company, we deserve to move this on faster so that we can help serve these customers that are asking for it. And so 100% based on this traction from dentistry.
Mm-hmm.
Um, I want to centralize our R&D. My team is ready to come full time. And so we're raising right now. We actually kicked off a couple weeks ago.
Oh, okay.
And so we're raising a 2 million round to basically make sure that we can strike while the iron's hot and support these changes that would take this from a somewhat valuable and clearly promising tool for dentistry to something that's kind of a necessity um, in every practice in the country. And it's really great because the step to get from where we are to there does not even seem that far. It's like four
Yeah.
discrete
Oh,
things that
that's
we need to
exciting.
do.
Mm-hmm.
Um, and they're not particularly easy, but we know exactly how to do them, and we
Mm-hmm.
can do them. And I'm just trying to get them done as quickly as I possibly can.
I
And
love it.
so that's basically where we are, where
Got it.
we were solving one specific problem in surgery. We realized there were um, you know similar problems that could be solved in various fields across the country, and we realized that the dental version of those problems um, could be solved right now and start bringing in money right now. And that's what we're working on. So I'm really excited. It is a fun time, and we're able to, um, yeah, and hopefully you'll be able to see the impacts of what we're doing really soon in the marketplace.
Awesome. I love that. Well, I mean, like yes. So like Tina, Shelley, I know y'all are in the
Hmm.
dental area. If anybody
Yeah,
have some folks for Kunal and all y'all out there, all of our
yeah,
out there know that like ClaraSim is currently raising. Kunal, before we take off, any
yep.
last words of advice for your fellow founders? Any words of wisdom you want to share?
Um, it's
No
it's
pressure.
hard to give words of wisdom because everyone's journey is really different. I mean, uh, going into this, I knew I was going to go into startups. I had heard all the stories. I talked to all the people, listened to the seminars. I was like, and they all told me, watch out for this, watch out for that. I watched out for those, and then other completely unrelated things, hit me like a
Yep.
truck, right? Um, that's going to happen. Everyone's journey is different. Um, but it is valuable to find friends in this space. Um, people that some people that are advisors and in the ecosystem, and then other people that are just founders that are going through their own version of your issues. Um, and it doesn't have to be someone that um, it can be like a direct advisor for the company. Like, I think it's important to have advisors for yourself too. Like, there are people that I trust that I've known for years that um, we support each other fully, and their companies have nothing to do with what I'm doing. They're not going to have the same investor pool. They're not going to have advice on how to get through FDA or anything like that. Um, but they've been through their own struggles. I've been through mine, and it's someone to lean on um, that can help you navigate a journey that literally no one else in history ever has. And so I think it's find friends. They don't have to be advisors that are relevant to your company, but have advisors for yourself too.
I love that. Yeah, I mean, like, surround yourself with people.
Yeah,
It's
yeah,
like you definitely don't
and
have
people
all
that have
I don't
been
have
through the
all
struggle
That's
themselves, you
always
know, like
helpful, right? Yeah,
important.
100%. All right, Kunal, well, it's been so great catching up.
Yeah,
We're gonna have to end on a little Viva, right?
yeah, just a little bit.
All right, awesome. Well, thank you again for joining us. We wish you continued success with ClaraSim, and in the dental space and in the surgical space. I love it.
Mhm. Thank you.
And with that, we'll head out on three. Ready? One,
Yep.
two, three. Viva la
Viva la
startup
startup
guys!
prize.
We'll see y'all next time. Thanks, everybody.